using cutting-edge treatments to care for the elderly skin. If you are like me and have a desire to help change the lives of people who really are not able to help themselves, join me as a member of my team. Feel free to email me anytime at careers@GreckenSkinInstitute.com.
Hi, my name is Dr. Peter Seda, and today I want to talk to you about my job at Bedside Dermatology. I joined Bedside over a year ago, and what I love most about it is it not only gives me opportunity to see great dermatological pathology, but it also gives me a chance to be a human doctor. What I mean by that is it gives me the time to spend with patients in the nursing home to actually provide them with care and love. Many times when people go into the nursing homes, they're racing through it just because they think the patients there are to die. And Bedside Dermatology reminds us that the nursing home is a place to actually live. If you want a job where you can be rewarded in terms of patient care and quality, and to also learn a lot about dermatology, then this is the perfect job for you. It is a fact that 93% of the time when a dermatologist biopsies a skin lesion, that it is in fact cancer. There's only a 7% error. Other doctors, when they go and biopsy skin lesions, there is a 77% chance of error. When a dermatologist excises a malignancy, there's a 100% clearance rate. What that means is, once the lesion is excised, it never comes back. When you look at studies comparing other physicians that are non-dermatologists, you will find that there's actually a 33% chance of the lesion coming back, and that's because they do not have a complete clearance when they excise it. The training at Bedside Dermatology allows you to be able to hone in on the pathology with accuracy. The training includes the reading of one textbook, including weekly lectures on each chapter, 12 weeks of coursework, 12 weeks of clinical dermatology in which you're in the clinics hands-on, procedural qualification clinics in which you practice all of the excisions, biopsies, and techniques needed in order to be very good at dermatology, and finally we also provide you with business training. 1 out of every 2 biopsies done by a dermatologist results in skin cancer. And when it is compared to non-dermatologists, only 1 out of every 40 lesions are skin cancer. This means that a lot of lesions that are done are unnecessary when a dermatologist isn't doing the biopsy.
As Dr. Peter Seda, our Chief Medical Officer, told you, there are many reasons to consider a career with Bedside Dermatology. The effectiveness of our treatment and the ability to form relationships with people that are typically left alone really creates an outstanding opportunity for anybody in the healthcare field. Visit us online at GreckenSkinInstitute.com or go to careers@GreckenSkinInstitute.com to learn more about this outstanding opportunity. At Bedside Dermatology, we receive letters. People think that treating skin disease oftentimes is trivial. I contend that people that itch suffer more than people that are in pain. Here's a letter I received. Dear Dr. Grecken, I cannot thank you enough for the generosity of your time when you spent treating my mother. My mother told me her legs have itched for over 15 years. Every doctor that she mentioned it to dismissed her at hand. You spent the time to sit down with my mother, to listen to what she had to say, and you helped her. This Christmas, my mother told me, was the first Christmas she ever spent without itching her legs. I'm eternally grateful, sincerely. This is the benefit of what we do at Bedside Dermatology.